I'm going to give a little tutorial on foam rolling, and specifically foam rolling for if you've got any back pain or knee pain. So we're going to focus a little bit more on the lower body. So rolling out our glutes, the hip area, the IT band, not specifically on the IT band, but it will help with IT band tightness. We'll roll out some quads, some hamstrings, and we might get a little bit into the low back as well. So I have a fairly firm foam roller. You can get softer ones and you can get ones with kind of the knobs in them. They're more specific for trigger point work, but any foam roller will work for you. And if you need to start with a less firm one, if there's too much pain in the beginning, then start with that and then work your way up to a firmer foam roller, okay? So we want to start on one side, so we're going to work one side and then the other, okay? So first we want to find that little pocket that's kind of in between the top of your hip bone, or your pelvis, okay, and the lower part of your pelvis. So there's kind of that little pocket, kind of a little fleshy pocket in there, nice and juicy. And okay, and this gets really, really tight. And that usually pulls on the IT band. So rolling out your IT band is actually not that effective. It's a tendon, a very, very long tendon in the side of your leg, in the side of your thigh. Okay, and so rolling it out is not really going to loosen it all that much. Rolling muscles is always better than rolling tendons. You can do that, but that's kind of more specific and more trigger point work, which we can get into later. But for now, for the purposes of just loosening everything up and reducing pain, it's better to just roll the muscles, okay? You don't need to spend very long on any one spot. You just kind of want to find the juicy spots, like, ooh, there's a spot for me. And you kind of want to stay there for 30 seconds, maybe a minute, but you don't really need to overdo it. You get to a point where rolling after a while doesn't really do anything. Okay, so it's kind of right in the beginning until things start loosening up for you. And usually the pain will start to reduce. If it starts to increase, then you may not want to roll there yet. You may want to work up to it or start, like I said, with a softer foam roller, okay? Good, so we're done with that. Then what you're gonna do is you're gonna sit on your foam roller. And so I'm still rolling out my right side, okay? So put our right leg up on top, if you can, if you have that flexibility, okay? So that you can lean to that side of your glute, okay? So I'm right kind of on the top part of my glute, and I'm just sort of finding again those juicy spots. I can push my legs back and forth, or rotate my legs back and forth, kind of find that area, and then I just roll like inches, right? You don't need to roll a very big area. So I'm just rolling kind of a small area, a little bit at a time. I move around to find another spot. Ooh, that's juicy. I stay there for a little bit. So you kind of get the idea, okay? So once you're done with that, then you're gonna move on to your quads, okay? So we wanna lie down, and you're still rolling one side, okay? So you can keep this other leg sort of out of the way. Just I sort of bend my knee to one side, and I'm now rolling just the top part of my quad. So I found the top part kind of just below the pelvis where the quads attach, and I'm just rolling out that top spot. So you just spend a few moments there, then you can roll it on down, find another tight spot in your quad, and you can work your way all the way down. And then we're going to get to the knee area. Now, you don't want to roll on top of bone, okay? So we're gonna find a spot just above the kneecap, all right? That's the other part where the quads attach. Is right under, goes under the kneecap and over, okay? So just above, right there, where the muscles get pretty tight, okay? And you want to spend a few moments there. And then the last thing we're going to roll, I find rolling the hamstring not to be quite as effective, but you can do it. It's not going to hurt anything. So I kind of lift myself up so that I can put pressure in the hamstring. If you're just sitting here on the floor, you can't put a lot of pressure. So if I lift my bum just slightly off the floor, and then I roll up and down, just a few spots, do a little bit at a time, just to loosen that hamstring up. All right, and then we're gonna move back up to the low back. So this is for those of you with more low back pain. Okay, so we're gonna find now that area right above the hip bone. Remember, we found that spot that was just below the hip bone, that little pocket that we found. Now you're gonna go right above the hip bone, and you're just gonna lie down gently, okay? You don't need to lie all the way down. But there's a little spot down at the bottom there where the QL is. That's another muscle in this side. And that can get really tight. And then your lats, the lower part of your lat muscle, that big wing muscle that's in your back that we work out a lot, that can also get really tight and pull on that low back on the spine, okay? So we're kind of getting those two spots right in there, nice and juicy, okay? So I don't want you to roll right here. I don't want you to get up and roll, okay? I just want you to lean into it, and then you're gonna kind of roll back and forward until you find a good spot, and then just spend a few moments there, okay? And that should help loosen up any tension in the low back. All right, and that is your tutorial on hips, knees, and low back. Stay tuned for more.